Good morning, ladies and gentlemen. I'd like to present to you today our data showing how lentiviral-gene therapy with conditioning can effectively rebuild the immune system, particularly the humoral immunity in older patients with HSCs or X-linked severe combined immune deficiency who have failed one or more bone marrow transplants prior to this. So, X-linked severe combined immune deficiency, or HSCT, is due to mutations in the IL-2RG gene, which causes profound immune deficiency. And therefore, patients present with life-threatening infections at diagnosis, generally in infancy, and therefore they require an urgent bone marrow transplant to try and restore immunity. The best outcome is if they can get a transplant from a matched sibling. But most of these patients do not have a matched sibling donor. And so many of these patients end up getting a half-matched transplant from a parent without conditioning. And in these patients, they engraft the normal T cells, but without restoration of the B cell or NK cell function. So these patients are alive, but they suffer the long-term consequences of this partial immune reconstitution. And the problems that they continue to face include a lifelong immunoglobulin supplementation. Many of them have recurrent and chronic infections. They can have warts that are very disfiguring and quite extensive, malnutrition, growth failure, and many also suffer progressive gut and lung disease. Gene therapy as an alternative modality to treat the bone marrow transplant uses an engineered virus vectors to insert a normal IL-2RG gene into the patient's stem cells, and these are the cells that produces the blood cells. The previous studies using the mouse retroviral gene therapy without conditioning to treat infants with HSCs were able to manage to restore the T cells, but also without correction of the B or NK cells. However, when this gene therapy approach was tried in the older patients, it failed to even restore the T cell function. So this raises the potential concern that these older patients have a difficulty in engrafting, have a barrier to engraftment of the gene-modified corrected cells. In addition, as we've heard, the use of these mouse retroviral vector for gene therapy has caused leukemia not only in the HSCT infants, but also in chronic granulomatous disease and Wiskott-Aldrich, drawing attention to the potential problem with this vector. So to address these concerns, we use a lentiviral vector, which is constructed from HIV virus, and it allows incorporation of safety features that include self-inactivation and insulators that would greatly reduce the cancer potential. We also use low-dose busulfan conditioning so as to create space for the incoming gene-corrected patient cells. So we have treated 5 patients so far. They're aged 5 to 24 years, and we present data that include up to 3 years post-treatment. On the left, so these figures show the gene marking levels. On the left is the gene marking level from patient 1 that we've had significant follow-up for up to 3 years. And what you can see here is that there's significant levels of gene marking in multiple immune cell lineages, and in patient 1 that continues to improve even out at 3 years. On the right, we show the early phase gene marking of all the treated patients. We were able to include the recently treated patients because gene marking in the B cells and the myeloid appears early. And this is the most exciting data we have to date. We show that not only do we get gene marking in the B cells, we actually get restoration of the humoral immunity. And here we show robust production of both IgG and IgM. The first 2 graphs are the levels from patient 1 and 2. And you can see in patient 1, who was receiving weekly IgG supplementation, is now achieving normal range of IgG levels despite being off any IVIG supplement, as indicated by the arrows, for over 2 years. You would also note from the graphs that the IgM increase precedes the IgG increase. So we've used this increase in IgM kind of as a marker for B-cell correction. So the last graph on the right, we are able to show you IgM levels from all of our treated patients, and you can see the gray bar indicates the normal range of IgM, how these patients have shown production of significant IgM even early post-treatment. So in both patient 1 and 2, not only do they produce IgG, they in fact also show vaccine-induced immune responses. Patient 1 and 2 also cleared their chronic norovirus infections that they have had for many years prior to gene therapy. So here are some figures showing some of the clinical benefits that we see post-gene therapy. On the top is before and after shots of warts that you can see it improve following treatment, and the molluscum on the bottom. And then on the right is the graph showing the albumin levels in the blood of all our patients. And you can see they have now reached normal range. And this is an indication of improvement of nutrition. And we think also reflects their improved gut disease as well. So in patient 2, despite improved immune function, he unfortunately died of a right lung bleed at 2.25 years post-gene therapy. We show here the CT scan of this patient in June 2013, prior to gene therapy, where the thick white lines are indicative of permanent structural changes causing the bronchiectasis. And you can see the CT scan done 2 years later that these were not changed. So what this tells us is that gene therapy cannot correct pre-existing lung damage. And so, as Dr. Daly referred to it in the beginning with concerns about vector-inserted mutagenesis, this is our effort to monitor for adverse events by doing deep sequencing. And the pie charts represent the integrations that we've retrieved from our 2 patients out at 30 months and 24 months. Each slice of pie is indicative of the relative contribution from each clone. So here you see over 60,000 unique integration sites. And what this shows is we have a huge diversity, and there is no emerging concern in single clone. So to summarize, I think we showed data from our lentiviral gene therapy with conditioning for the older HSCT patients that this is safe and well tolerated, that we have achieved persistent multi-lineage gene marking, that this is accompanied by improved cellular and humoral immunity, as well as sustained improvement of clinical status. And again, gene therapy does not appear to reverse prior organ damage, supporting an early intervention to improve immunity in these patients before such damage occurs. Thank you.